Hi, I'm Cindy, and I'm a registered nurse here to talk to you today about oxygen administration devices. Hypoxia refers to insufficient oxygen supply to the tissues of the body and may have a variety of causes. Patients with altered breathing patterns, airway obstruction, or suffering from many different acute or chronic conditions can present with impaired tissue oxygenation. This respiratory dysfunction may be improved by the movement of oxygenated air in and out of the lungs, also called ventilation, by the diffusion of this oxygen at the pulmonary capillaries, and by the transport of oxygen to the tissues, also called perfusion. Oxygen administration involves delivering oxygen to a patient at a higher concentration than is normally found in room air. This oxygen can be administered via various devices, each with its own considerations.